Good morning everyone. Today's topic is fourth cranial nerve, that is trochlear nerve. Its unique features, functional components, nucleus, course and distribution, and applied anatomy is going to be discussed in this session. The trochlear nerve, it is purely motor and supplies only one muscle, the superior oblique muscle of the eyeball. Coming to the unique features, it is the only cranial nerve which emerges on the dorsal aspect of the brain, and it is the smallest cranial nerve, and it's the most slender of all the cranial nerves, and it is the only nerve that shows decussation of fibers before emerging from the midbrain, so that the left trochlear nerve contains fibers originating in right trochlear nucleus. The next unique feature is the nucleus receives only ipsilateral corticonuclear fibers, and phylogenetically it is the nerve of third eye. The trochlear nerve, it has the longest intracranial course of all the cranial nerves. That's all about the unique features of trochlear nerve. Next we see about the functional components of the trochlear nerve. There are two functional components, general somatic efferent fibers and general somatic afferent fibers. The general somatic efferent fibers, it arises from the trochlear nucleus in the midbrain and supplies the superior oblique muscle of the eyeball. The general somatic afferent fibers, it sends the proprioceptive impulses from the muscle to the mesencephalic nucleus of fifth nerve. Next we see about the nucleus. The trochlear nucleus is situated in the ventromedial part of the central gray matter of midbrain at the level of inferior colliculus. Ventrally, it is closely related to the medial longitudinal bundle. The connections of nucleus are similar to those of oculomotor nucleus except for the pretectal nuclei. The course of trochlear nerve is divided into four parts: intraneural course, precavernous part, intracavernous part, and intraorbital part. First we see the intraneural course of the trochlear nerve. The nerve runs dorsally around the central gray matter to reach the upper part of the superior medullary velum, where it decussates with the opposite nerve to emerge on the opposite side. The trochlear nerve, it is attached to the superior medullary velum, one on each side of the frenulum veli, just below the inferior colliculus. The trochlear nerve emerges from the posterior aspect of the midbrain, just below the inferior colliculus, on each side of the frenulum veli. Next, coming to the precavernous part. The nerve winds round the superior cerebellar peduncle and the cerebral peduncle just above the pons. The nerve passes between the posterior cerebral and superior cerebellar arteries to appear ventrally between the temporal lobe and upper border of pons. The next part is intracavernous part of trochlear nerve. The nerve enters the cavernous sinus by piercing the posterior corner of its roof. Next, it runs forwards in the lateral wall of cavernous sinus between the oculomotor and ophthalmic nerves. In the anterior part of sinus, it crosses over the oculomotor nerve and becomes lateral to it. Next, we see the intraorbital course of trochlear nerve. The trochlear nerve enters the orbit through the lateral part of the superior orbital fissure. In the orbit, it passes medially above the origin of levator palpebrae superioris and ends by supplying the superior oblique muscle on its orbital surface. Next, we see the clinical correlation of the trochlear nerve. The injury of trochlear nerve will cause paralysis of superior oblique muscle of the eyeball. This will clinically present as extortion of the eyeball and weakness of downward gaze. As a result, the patient faces difficulty while going downstairs or reading newspaper. The patient complains of diplopia. When the patient looks laterally and in glances on looking downwards, there is compensatory head tilting to the opposite side. So the paralysis of trochlear nerve result in defective depression of the adducted eye and diplopia. Thank you.